Beautiful Mind is a 2001 American biographical drama film based on the life of John Nash. It was a huge hit and went on to gross over $313 million worldwide and won 4 Academy Awards. It follows John Nash, a mathematical genius, as he makes a breakthrough in economic theory, which eventually wins him the Nobel Prize. John experiences hallucinations and delusions that he is a codebreaker for the U.S. against Russia during the Cold War. The movie follows John through his illness and his eventual remission. Today, we are going to go deeper into John Nash's mind from a clinical perspective. First, we will focus on the individual and dig into John's thoughts, feelings, and behaviors. Second, we will focus on the environment and review the environmental factors that were showcased in the movie. A Beautiful Mind showcases the life of John Nash, but what specific thoughts, feelings, and behaviors are highlighted?
Maybe you're just better with the old integers than you are with people.
My first grade teacher, she told me that I was born with 2 helpings of brain, but only half a helping of heart.
We witness Nash's extreme intelligence. Moreover, Nash has great difficulty understanding how to behave in interpersonal and social situations, as well as a lack of ability to relate to others.
So, John, no family, no close friends. Why is that?
I like to think it's because I'm a lone wolf.
Nash displays arrogance and apathy towards others.
You're not easily distracted, are you?
I'm here to work.
He feels that he is above going to class or doing the same work as his peers.
Hey, Nash, I thought you dropped out. You ever gonna go to class, or...?
Classes will dull your mind.
However, these feelings are ultimately validated.
Well, Mr. Nash, with a breakthrough of this magnitude, I'm confident you will get any placement you like.
So, is Nash's behavior considered abnormal? Let's see some examples of even more extreme abnormal behavior that he exhibits. Nash experiences hallucinations. A hallucination can be an auditory or visual experience that is often perceived as voices distinct from the individual's own thoughts. Nash also experiences delusions, which are fixed beliefs that do not change in light of conflicting evidence. He experiences disorganized thinking, which are incoherent or rapidly switching thoughts, typically inferred through speech. Nash exhibits negative symptoms, which are diminished emotional expressions, and avolition, which is a decrease in motivated, self-initiated, purposeful activities. Let's take a look at some of the specific hallucinations that Nash encounters. John Nash has 3 reoccurring hallucinations throughout the film. The first is his roommate Charles.
Don't do it. Don't mess around. Bust your head. Go on. Bust that. What? I said, why don't? God damn it, Charles. What the hell is your problem?
Charles was watching. He was okay.
No one here.
Charles was watching.
No one here.
He's been injected with a cloaking serum. I can see him because of a chemical that was released into my bloodstream.
Another hallucination is Charles's niece, Marcy.
My uncle says you're very smart. Not very nice.
His most dangerous hallucination is William Parcher, Big Brother.
We need to move on this.
Who's Big Brother?
A member of the Department of Defense and colleague of Oppenheimer.
Get in. Hurry.
John Nash's hallucinations directly influence his delusions. His main delusion is that he is a secret agent for the Department of Defense and is trying to stop the Russians by code-breaking periodicals.
Control of the bomb and intends to detonate it on U.S. soil. Their plan is to incur maximum civilian casualties.
He has persecutory delusions, which is the belief that someone or something is following and is going to hurt you.
No. Charles! Charles, the Russians! Charles, the Russians! Call somebody! Call somebody, Charles!
Specifically, Nash believes that Parcher and other spies are pursuing him.
Stay down.
Nash is diagnosed with schizophrenia in the film. Schizophrenia is part of the schizophrenia spectrum and other psychotic disorders in the DSM-5. They are defined by abnormalities in one or more of 5 domains: delusions, hallucinations, disorganized thinking, grossly disorganized or abnormal motor behavior, and negative symptoms. However, there are other psychologists who disagree with this diagnosis. Parker, in 2015, stated Nash should have been diagnosed with bipolar, while Capps, in 2005, stated Nash had narcissistic personality disorder. John is very close to meeting the criteria for bipolar disorder, but it's unclear based on the movie if his psychotic disturbances occur during a manic or depressive period. To properly diagnose John Nash, a private consultation would be needed to determine if his hallucinations and delusions occurred during a major mood period. Without interviewing John one-on-one, it's uncertain whether to diagnose him with either schizoaffective or bipolar disorder. Based on the information from the movie, Nash meets the criteria for schizophrenia. For criteria A, 2 or more of the following must be present for a significant portion of time during a 1-month period. At least one must be delusions, hallucinations, or disorganized speech. He meets number 1 because he had delusions that he is being followed and that he works for the government to break codes. He meets number 2 because he hallucinates 3 people who interact with him. He meets number 3 because his speech is disorganized throughout the film, most notably when he gives a speech that is mostly word salad. He meets number 4 because he has grossly disorganized behavior, which is consistent across the entirety of the film. He meets number 5 because he displays negative symptoms, most notably diminished emotions. He meets criteria B because his level of functioning is markedly lower than before the onset of his disturbances. He refused to go to school and eventually is unable to work due to his illness. He meets criteria C because he shows continuous signs of the disturbance for at least 6 months. He meets criteria D because schizoaffective, depressive, or bipolar are excluded due to a lack of information on major depressive or manic episodes. He meets criteria E because there is no evidence that he was on a substance. He meets criteria F because we lack information on Nash's childhood and cannot diagnose autism spectrum disorder. We would diagnose him with schizophrenia, which is coded as 295.90 F20.9. By the end of the movie, we would use the specifier multiple episodes, currently in partial remission. This is because he had stopped taking his medication and still saw the hallucinations, but was able to ignore them. What is the precipitating cause? Does their history relate to the disturbance? According to Avila et al., in 2003, there is evidence that schizophrenia is genetic in nature. John Nash may have been always destined to have schizophrenia. However, John Nash being involved in complex mathematical algorithms during his doctoral work and subsequent job appeared to be the catalyst that encouraged his delusions of code breaking for the government. We really don't get any information about his earlier history to see if it relates to the disturbance. The best model of causality is the biological model. According to neura.edu, in 2017, schizophrenia is a complex disorder and has been associated with many causative factors, both genetic and environmental. With a hereditability estimate around 80%, schizophrenia has a strong genetic component, and this is reflected in the large number of genes that have been associated with the disorder. John had many environmental factors that are influential to his disturbance. According to Paul Fearon in 2006, there are many environmental factors that add elevated risk to developing schizophrenia. For example, he stated many migrants had increased risks of developing schizophrenia. They are theorizing it is due to the trauma they are exposed to while dealing with war and moving to another country to find safety. The era Nash lived in had an influence because he was living in the Cold War era, which is what his delusions focused on. He thought the Russians were after him.
We've been intercepting radio transmissions from Moscow. computer can't detect a pattern, but I'm sure it's code.
Going to school for mathematics could have encouraged his delusions of code breaking. Being seen as an outsider could have also encouraged him to start his delusions to feel less isolated and to cope. Stress from going to school could have triggered the delusions to cope. The amount of medication he was prescribed could have given him avolition.
But it's difficult with medication because it's hard to see the solution.
Hollywood often distorts mental disorders in film. John Nash, after seeing the movie for the first time, said that it was a very good movie, but it was not him. However, A Beautiful Mind brings a great visual perspective to what hallucinations and delusions can look and feel like to the person affected by them. There are a few differences between the real John Nash and the movie, according to Sylvia Nasser's biography on Nash, also called A Beautiful Mind. It is reported by Parker in 2005 that John Nash's hallucinations were not visual as portrayed in the movie. John reported only auditory hallucinations. According to John Milnow, who lived with Nash briefly, noted that John had reoccurring relationships with other men. In the film, they do not bring up his homosexual experiences. The way others interact with someone dealing with a mental illness can be a positive or negative factor. John had many people in his life before, during, and after his illness. John Nash's wife, Alicia Nash, in the movie is shown as a strong force by his side, helping him through his illness. Alicia didn't seem off-put by his lack of awareness of social cues, and she seemed accepting of his eccentric and obsessive tendencies towards work and solving equations. She appeared very scared when she found out Nash had the delusions and hallucinations. She was stressed when she was taking care of him and was unable to engage with anything, even their unborn child. She is very supportive throughout the film and is willing to help him when he wants to get off his meds. His school buddies and eventual co-workers, Sol and Hansen, Bender and Hellinger, were clearly weirded out by his behavior in the beginning of the movie. They thought he was odd and would occasionally make fun of him for his lack of social awareness in public situations. They seemed exasperated when he would forget to go to classes or not turn something in for work. After they found out about his illness, they were supportive and encouraged him to continue to come to Princeton. His psychiatrist, Dr. Rosen, first committed him and then worked with him to understand the delusions and hallucinations weren't real. He gave him electroshock therapy and put him on medication. His Princeton colleagues showed respect for his career and allowed him to stay on campus after he was unable to teach. John was given treatment in A Beautiful Mind. He was committed to a psychiatric unit twice. During that time, they broke the delusions, gave him electroshock therapy, and put him on medication. John didn't respond well to the medication and began exhibiting catatonic behaviors and lost interest in daily life. With the support of his family, John was able to get off medications and live with the delusions. Today, we went deeper into the mind of John Nash. We focused on the individual and looked at John's thoughts, feelings, behaviors, and diagnosis. We also reviewed the environmental factors that impacted his disorder. Overall, John Nash had an interesting and fulfilling life despite his illness. It was very extraordinary to witness John learn to live with his hallucinations. We believe that John Nash could have benefited from modern antipsychotics and continued therapy to explore the hallucinations. John Nash is a great example that mental illness is something to be understood and treated rather than feared.